I'm going to teach you about a very important bone in the body. I consider it one of the most important, and we're going to talk about C1. So we're going to talk about this bone or vertebrae at the very top of the spine, right underneath the skull. So what is the C1? As I mentioned, it's a bone, it's a vertebra at the top of the spine. This is your cervical spine, C, okay, right underneath the skull, and that's the first, so C1, okay? Understanding it is very important and impactful because many people can have an issue with the C1 where there is movement or a deviation. Now, what is the issue with that? If we look deeper and think about what's going on there, what is close to that are these structures here, which are nerves. So when we talk about C1, we don't just worry about a bone with some type of misalignment. We worry that this bone has a negative influence on the surrounding nerve, even vascular structures, blood flow, those sorts of things, because it has an influence when it deviates. Well, why would it deviate? That's because your C1 bone on your C2 has a tremendous amount of movement. You have a lot of mobility. So if I was to turn my head, the majority of that turning actually comes from the C1 on the C2. And when we have a lot of mobility, we lack stability, so it allows it to deviate and influence these structures. Now, if something was to get affected in those nerve structures, what is the influence? So let's talk about what it can do to the body. And now I have my little list here. Now keep in mind that I'm going to list the top 10 things that I see related to people complaining about issues with their C1 alignment in terms of an issue with where it's misaligned, where it is putting unnecessary influence on nerve structures. So here we go. Two of the most common that I actually see are excessive irritability, not just general irritability if you didn't sleep, but I'm talking about excessive ongoing irritability, excessive fatigue. We of course see neck pain, we see headaches, and commonly we see a lot of sleep trouble with that. Now we're going to get into why on another video, but that's because one of the nerves that the C1 affects is going to be the vagus nerve. We also commonly see dizziness, vertigo, a lot lower of a mood. People are just feeling like they're dragging it. Fogginess. Fogginess is very common. When I had my issues in the past of my C1, I had such an array of these issues. The last one that we always have to discuss, even through the vagus nerve, is digestive issues. Now, this is not an exhaustive list of what you can experience. I'm going to put a bigger list down below. But if these resonate with you, that is why I always encourage you to get your C1 evaluated. Now, of course, when I C1, I mean the C1 vertebrae, get its position evaluated. We just use it, we just say C1 in a very relaxed way. But get that evaluated just to make sure that you are not struggling with any of these symptoms unnecessarily with life and any other things that you might think are going on. All right, I will discuss more on the C1 related to what you're dealing with, correction, evaluation in the weeks to come. So stay tuned.